Hey guys, I hope everybody's doing good. This is a video I should have done a long time ago because I've been having problems with my teeth back that attach to the sinus cavity. Obviously I've had long-term sinus problems, so the two things go hand in hand. But today what I want to tell you about is dental implant surgery. Now, when you go to look up on the YouTube search engine about dental implants and pain and all these things to try to do some research, what you're going to find is lots of dentists telling you how great the procedure is and that it's not painful and you're going to have a great smile and all these things are going to change your life for the better. And I hope a lot of people have had that result. I did not have that result, of course. Things don't tend to go that way for me. So I had, well, first of all, let me back up. I had a root canal in the tooth behind it, the very back tooth. And that did not go well. It had to be redone. And eventually the tooth had to be pulled. And I did follow suit with the tooth in front of that. The tooth I'm going to discuss today, root canaled, not successful, and so we opted to try the dental implant because, as we know, if you don't have a tooth where you have a space, then the rest of your teeth can spread apart and slide, and that's not something that I wanted to happen. Obviously, no one wants that to happen, but with all the problems I've had, I don't think I would do another implant, and if I had to be a little gap toothed, well, you'd see some gap tooth videos for me. But anyway, I digress. The tooth before the last one, it does butt up against the sinus cavity. We agreed to do the implants, and right now I'm going to post a picture of what that looked like. For a couple of weeks, I went with just a little post showing before the crown came in. And that I was fine at that point. I was healing. I mean, it was very painful, but I was healing. And one thing they don't tell you is you're going to have, after you go through this, you're going to have a lot of soreness, but you're also going to have a lot of I got canker sores. It really tore my mouth up. All the process of putting in the dam and all these different things really tore up the inside of my mouth. But that, again, eventually it healed. And I went for 2 to 3 weeks with the post. And I seemed to be healing. However, when they put the crown in, and this was done by the assistant, the second she put it in and pushed up on it, it created a popping and a pressure immediately up above the tooth. And I felt my entire face swell right here. Pressure and swelling in my face. No pain in the tooth. No pain in the jawline. Every time I go, they tap, tap, tap on it with all their little instruments. No problem. I said, doctor, the pain is up here. I was told at that time, oh, that's normal. It's going to go away. Yada, yada, yada. So, okay. So I left and it didn't go away. And the pain is not, pain never went away. It ranges about a 3 to a 4 on a daily basis, on a 10 scale. 0 being no pain, 10 being worst pain imaginable, a 3 to a 4. But when I get a cold or something like that, I get tons of swelling and it's very painful and it radiates into the ear. So it's not good. And they re-x-rayed me and, oh, you're fine, you're fine. Went out for a second opinion. The woman said, oh yeah, I can feel all the swelling up there, but I don't really know. Maybe you should go to a maxillofacial doctor or surgeon. So I went there and he looked at my records and he didn't know either. And he said, well, maybe you go back to your sinus doctor. Maybe they can order some imaging and you can get to the bottom of it. And sure enough, when the sinus doctor ordered the imaging, I actually went to one sinus doctor who was not my original surgeon. If you guys have seen my sinus surgery videos, that doctor retired. I I miss him greatly, but he retired. Then I was referred to his new practice. And the guy that I saw said, oh, well, everything looks good, and diagnosed me with atypical facial pain syndrome. How do you like that? A pain syndrome. Anytime you get that's your first diagnosis as pain syndrome, run for the hills, look elsewhere. Chances are that there is something causing your problem. Now there are people out there with pain syndromes that are very real. I don't like to take away from that, but there wasn't a whole lot done to investigate the pain, and that he did not order the proper imaging, and so I fired him and moved on to the next doctor. So the next doctor that I saw immediately CAT scanned me. He had a CAT scan, a 3D one on the premises, and came up with my problem. And so right now I'm going to post a picture so you can see, before I say what the problem is, look at the picture and see what you think the problem is. Can you find it on the diagram? Okay, well, I'll give you a hint. Those two spaces that are supposed to be dark, there's something up in there, and it's pooling a little infection around it. Yes, so the perfect implant surgery that I had, it migrated up. That rod that's supposed to be stuck is up into the sinus cavity. And the sinus doctor saw that right away. And he said, here's your problem right here. And he's like, the mouth is very dirty, and you've punctured the sinus window. He's punctured it with that implant, with that little rod that they stick up there. And they like to assure you at the dentist's office that rod is very secure. But I promise you, I would bet $1 million it wasn't secure. And instantly, when they put the crown in and she went to push up on it, they didn't measure the rod correctly. It was too long, and that rod moved upward where it shouldn't be, because that day when they pushed that up there, the pain was instant. It was instant pressure. It was an instant popping. Anyway, I could go on and on about that. I'm going to not get myself too worked up, but I have a lot of problems with it. Now that we have the imaging, I have shown it to the implantologist that did the procedure, and he's reviewing those films now and says if I want it taken out and redone, that he will do that. So I'm in the process now of deciding if I'm going to pull it and leave it, or if I'm going to pull it and have it redone. It's very traumatic. I mean, I know that sounds like, hey, why wouldn't you want to have it redone? But it's very invasive. And you've seen my other videos. And sometimes for me, things just don't go how they're supposed to go. And I don't really, I don't know how successful it's going to be a second time. I don't understand exactly the process of, once that cavity is punctured, do you reseal that, or what? Is that an open spot? I don't really have good information on that. So I am following up with the sinus doctor and with the dentist to determine a course of action. But I do want you to take away from this video that those implant surgeries they're serious business, especially you have them in the back. Those back teeth on your top teeth butt up to the sinus cavity. They butt up to that maxillary cavity. And if they push that up too far or drill it up too high, that implant can migrate up into the sinus cavity. I'm going to put a link on here to another video that shows a woman whose implant just up and exited her jawline and went straight up into the sinus, and you can see the rod up here. That's horrible. It's very dangerous. So I just want to I just want to impart that if you are looking at having this done, it's not a benign procedure. It is a risky procedure. And if you're infection prone or prone to having things go erroneously, really consider one, doing it at all, and two, who's doing it. Make sure that you're having this done by somebody who has done a lot of them, who's very credible. Some random dentist should not be performing this procedure. And if you really, if you have a history like I have, I would have had it done by a maxillofacial doctor, period. And don't let anybody tell you after the procedure is done, if you're having pain, if you're having a problem, don't let them take a little x-ray of you and send you on your way and tell you you're fine. If you're hurting, if there's something wrong, get a CAT scan done and make sure they can see the inside of your bone structure and sinus structure to make sure that rod hasn't moved. So anyway, again, like always, with Kai channel, I'm open to questions, comments, personal stories. I'm really interested to see if anybody finds me. I hope somebody does, because really right now there's not a lot of great patient stories about success or non-success with dental implants. The video scene is flooded with people trying to promote the procedure. So, and that's fine, you know, it is what it is. But feel free to jump in and share. And again, thank you for subscribing, and I'll talk to you guys later.